Hey everyone, welcome to Modern Mental Health, your trusted space to understand the human mind, emotions, and overall well-being. Today, we're diving deep into a topic that affects millions around the world: anxiety disorders. We'll explore what they are, their symptoms, types, and what makes them such a significant part of mental health today. Anxiety is a normal human emotion in certain situations, such as before an exam or a job interview. It is defined as a state of apprehension, uncertainty, and uneasiness in anticipation of a real or perceived threat. However, when these emotions become excessive, persistent, and start to interfere with daily life, the term anxiety disorder is used. In fact, anxiety disorder describes a group of mental health conditions characterized by significant and uncontrollable anxiety that can affect nearly 1 in 3 adults at some point in their lives. Although each anxiety disorder has its own traits, they share common symptoms such as panic, restlessness, and an overwhelming feeling of dread. Fear, on the other hand, is an emotional response to an immediate threat and tends to trigger the fight or flight response. While anxiety can do the same, it usually leads to avoidance behavior and muscle tension. In some cases, anxiety comes in sudden bursts, leading to overwhelming distress within minutes, known as panic attacks. Panic attacks can include symptoms like a racing heart, choking sensations, shortness of breath, sweating, trembling, and even stomach pain. Chronic anxiety may also cause irritability, fatigue, poor concentration, and uncontrollable worry. To diagnose an anxiety disorder, symptoms generally need to last at least 6 months, be disproportionate to the situation, and significantly affect daily life. Whether socially, professionally, or personally, generalized anxiety disorder, GAD, is among the most common forms. It involves constant, excessive worry about multiple things, such as health, work, or family, on most days for 6 months or more. People with GAD often experience restlessness, poor sleep, irritability, and muscle tension. It's estimated that about 9% of adults will develop GAD at some point in life. Specific phobias are another widespread form, affecting around 10% of the population. These involve intense fear of particular objects or situations, such as heights, spiders, snakes, or flying. Even anticipating exposure can trigger anxiety. People with true phobias often realize their fear is excessive but still go to great lengths to avoid the trigger. Panic disorder is when individuals experience recurrent panic attacks, sometimes without warning. To qualify as panic disorder, attacks must happen repeatedly over a month or more and cause changes in behavior due to fear of future attacks. Although about 1 in 3 people may experience a panic attack in their lifetime, only about 10% develop panic disorder. Agoraphobia involves anxiety in situations where escape might feel difficult or embarrassing, such as crowded places, open spaces, or public transportation. People may even avoid leaving their homes. Extreme fear of being judged, humiliated, or rejected in social or performance situations, like public speaking. It often begins in childhood or adolescence and can be deeply disabling if untreated. Post-traumatic stress disorder, PTSD, is another form of anxiety that arises from traumatic events, such as accidents, violence, war, or natural disasters. People with PTSD may experience flashbacks, nightmares, and constant hypervigilance, as if danger is always near. Separation. Anxiety disorder involves excessive fear or distress when being apart from loved ones or familiar environments. Though more common in children, it can persist into adulthood. Obsessive-compulsive disorder, OCD, is often misunderstood. It's not just about being neat or tidy. It involves intrusive, distressing thoughts, obsessions, and repetitive behaviors, compulsions, performed to relieve anxiety. Examples include repeated hand-washing, counting, or checking locks. If these behaviors take up more than an hour per day or disrupt normal functioning, OCD may be diagnosed. Selective mutism is another anxiety-related condition where a person who can speak becomes unable to do so in certain situations, like at school or in public. It's often mistaken for shyness and can persist into adulthood. The causes of anxiety disorders are both genetic and environmental. People with family members who have anxiety disorders are more at risk. But life experiences play a larger role, including trauma, bullying, parental alcoholism, unemployment, or social stress. Women are about twice as likely as men to experience anxiety disorders, though the exact reason remains unclear. Biological factors, life experiences, and societal pressures may all play a part. Treatment options typically include psychotherapy and medication, alongside lifestyle changes such as regular exercise, relaxation techniques, and better sleep habits. Medications like SSRIs, for example, sertraline, fluoxetine, or escitalopram, are often the first line of treatment, while SNRIs, buspirone, or pregabalin can be considered if needed. For acute panic attacks, reassurance and controlled breathing are the most effective initial responses, while long-term reliance on sedatives is generally discouraged.